Thank you very much. And welcome to the last and very exciting panel of the first day. I am the Executive Director of the Global Innovation Hub for Improving Value in Health. The Hub is an international organization that was created by the G20 in the year 2020, the year when we had COVID-19. In the midst of that, there was a consensus on the importance of us having an international organization that is an accelerator for health systems to move to 21st century health systems that are of high value. And today, in this panel, we are launching a paper that addresses the topic of climate and how it links to high-value health systems or sustainable health systems. And the title of our paper is Tomorrow's Health System Today, the Need for High-Value Health Systems in Promoting Health and Optimizing Care Delivery in the Midst of Climate Change. In our panel, we will address the themes of strategies to adapt and build resilience against climate change, the role of international collaborations and policy frameworks, and thirdly, innovative yet practical solutions to mitigate the health impacts. I would like to encourage you to download the paper and read it. And to kickstart the panel, I'm truly delighted to invite the author of the paper, Dr. David Bernstein, who is an orthopedic surgeon or orthopedic surgery resident at Mass General Brigham and Harvard Medical School, as well as a senior researcher at Harvard School of Business. It was an absolute pleasure, David, to work with you on this piece, and welcome.
Thank you for the warm introduction, and thank you everybody for sticking around for this important session. So climate change and healthcare sustainability are two global megatrends with broad human impact. And historically, we've really thought about these in two different ways. When we think about climate change from a very high viewpoint, it can have a negative impact on 3.3 to 3.6 billion people. And it can negatively impact GDP globally by 10 to 18% by 2050 unless we take action. But at the same time that we think about climate change, we actively are thinking about, both in the kingdom, in the United States where I'm from, and around the world, how do we promote and ensure and optimize health and healthcare system sustainability for all of us? How do we ensure that all of our citizens have the absolute best care possible? But today, we're spending more and more money without a clear return on investment insight. We don't know what we get many times for the dollars we spend. And there's a risk of growing health disparities despite efforts to address this. And so today, climate change and healthcare sustainability challenges are often tackled independently. We think about our carbon footprint globally, at a broad scale, not just specifically within healthcare. And while important, we need to consider the list of all of these important topics in climate change. From a health and healthcare sustainability standpoint, we think about how do we reduce costs but optimize the outcomes for our patients. We have an increase in chronic diseases, and how do we best manage that? How do we care for these populations that need us in today's world? And how do we address the health disparities and inequities that are faced globally? And we can try to tackle these one at a time, but if you try to tackle these giant megatrends one at a time that the entire world is facing, you can often fall short. You put Band-Aids on solutions when if you combine them and you really think through what can be accomplished together, you can actually drive meaningful change that impacts positively both together. And so the solution for health and well-being of a population and its workforce is grounded in solving the problems that are based both on the climate change issue as well as the health and healthcare delivery sustainability issue. we can reduce novel pathogens and care for people all around the globe in a more efficient, cost-effective manner that really drives patient care forward and human health forward. And that's some of the amazing work being done here in the Kingdom, in the United States, in everybody's country around the world, that we can together move this forward for the next generation. And so as Dr. Ream mentioned, we published a report as a team that really highlighted some tangible goals. How do we move this forward? How do we actually make that progress? It's easy to think about certain things, but to take that and make it actionable is really the key for human health. And so our 3 recommendations from our report. The first is to build specific knowledge-sharing coalitions to share best practices and avoid unnecessary failures. Now, this sounds simple, and at times it may sound that we are just thinking in this situation, but I'll give you an example. 2 weeks ago, a week and a half ago, there was a major hurricane in the United States. During that hurricane, one of the major manufacturers of IV fluids was hit hard by that hurricane, and us at Mass General Brigham actually had to delay and cancel elective cases that people had waited an extended period of time in order to receive. We are now trying to catch back up and searching for other means, and so it's a perfect example of how climate change and healthcare go hand in hand, and we need to share that insight so that maybe in the future, different countries, different organizations may not rely as much on one provider of IV fluids, for example, but broadens the scope of how do we create a system that is resilient, responsive, and can persevere through challenges related to health and climate change. We need to invest in accelerating and scaling a movement to drive efficient progress. Now, when we saw COVID-19, all of a sudden there was this global movement. How do we address this challenge? How do we bring people together in order to solve this crisis currently at our doorstep? Now, I would argue that both climate change and healthcare system sustainability is truly at a crisis and at a tipping point. Yet we don't feel it every day like we did for COVID-19 when it really took off. And so in order to really drive that change, we need to build and scale a movement and accelerate that change, because we all deserve better healthcare and a better world as we address these 2 challenges. And the third recommendation is to utilize international and national resources to design and implement system changes on a more local level to reduce that low-value care, and which will build a high-value health system that is prepared, responsive, and resilient against climate change. And ultimately, as was touched upon in the prior panel, there are international and national viewpoints and expertise that every country can touch upon, but that ultimately the local drivers know those communities best and can drive the change that we all need to see. And so I urge you all to download the report through the G20 Innovation Hub. It can be downloaded on this QR code and on the website. And it's truly a pleasure to be here today and to join my esteemed panel as we talk about this important topic and the intersection of climate change and health and healthcare delivery sustainability in more detail. Thank you.
Sorry? Thank you. Oh, there it is. Okay. Good evening. Thank you so much, David. That was great. Good evening, everyone. My name is Abela Anidi. I'm the Director of Partnerships and Engagement for the Global Innovation Hub for Improving Value in Health. I am so excited about today's conversation. We have a truly diverse panel composition with knowledge and expertise and experience in the subject of 2 interconnected topics of climate change and healthcare system sustainability. And so you've already been introduced to Dr. Ream and Dr. Bernstein, but before I get started, I want to introduce our 2 other panelists who can join me on stage, and as they walk up, I'll introduce them. So we have Richard Cantlay, who's the Global Healthcare Leader at Matt McDonald, a global management, engineering, and development consultancy working across many different sectors, including health consultancy services and health system strengthening programs in low and middle-income countries. And then we have Bjorn Almer, who's the Chief Business Officer at Skana Care, part of the government of Sweden's providing G2G international collaborations. And so thank you all for joining me on the panel today. And let's dive on in. I will offer a slight reminder to the panelists that keeping the responses within the frame of 2 minutes or so would be greatly appreciated. Let's go with the first question for you, Richard, if you don't mind. Many consider the topic of climate change with a focus actually on carbon emissions. And so I'm curious, from your perspective, what is healthcare's own contribution to climate change, and what should healthcare systems be doing to reduce their carbon footprint?
Okay, thank you very much for that question. So I think it's reasonably well documented that healthcare contributes about 5% of all global emissions. So if healthcare was a country, it would be the 5th biggest emitter on the planet. Now, one school of thought is, well, it's healthcare, it's saving lives, and therefore it doesn't need to worry about its contribution to climate change. My view is that actually there's a double imperative for it to do so. Firstly, it's got the general obligation that we've all got, that every country's got, to reduce emissions. But secondly, we can't have places of healing contributing to the burden of disease. So I think we really need to think in the context of high-value health systems. I think that should include a health system which is not detrimental to the environment and is doing everything it can to heal it. In terms of what can we do, I think typically health systems have been designed around health and patient outcomes and financial measures. Those are absolutely the right things upon which to design a healthcare system. But I think there is an opportunity to put and think about carbon alongside those considerations. I think they're very complementary, which is what the presentation has talked about. Often if you do things that reduce money, bring care closer to home, move away from hospital-centric models of care, then you will actually reduce carbon at the same time. So this is all about co-benefits, which is the whole point of this. How do we think about climate change as an integrated part of how we design health systems rather than a side silo that then has to kind of deal with something that's already been put in place without considering climate change.
Couldn't agree more, Richard. Your point on co-benefits, the overlapping circle, the interconnected nature of carbon emissions and improving and accelerating and strengthening health systems, they're all interconnected. So I appreciate you landing that point further. Bjorn, want to bring you into the conversation now. And we had a check-in last week, actually, where you mentioned, and I think we talked about sustainability, and you mentioned at this point, there still remains challenges to drive, quote unquote, real action. What did you mean by that?
Well, the industry is, for patient safety, of course, very conservative. So one point could be, as in all change processes, that change takes time before you do it. Having said that, I think all healthcare professionals are quite aware of the climate crisis and very keen to do something about it. The challenge is that at the very senior level, there is interest to do something about it. And I think most healthcare professionals have an interest in doing something about it. But the disconnect comes in between because we are still pushed for budgets. Some things can, of course, be done quite quickly. Some low-hanging fruits that have very low cost, and you could do exemption lists for chemicals that you don't want to use anymore. You could remove desflurane, which is a highly carbon equivalent, like 3,700 times or something. So if we stop using desflurane, which is I know Scotland has already done it several years ago, EU is doing it now, that's going to have a huge impact. But still, at the end of the day, 70 to 80% of the climate impact from the healthcare industry, and the healthcare impact from the industry is 49 times the entire climate impact of my country, Sweden. So it's a huge impact, like said before. So what we need is to work with the supply chain. 70-80% is there, and to get incentives so that when something is more expensive but more sustainable, you can still choose it. Now, so everything comes down to money. I think all of us want to do the right thing, but then we need to put a price on carbon. And that's happening now in many places. And it might not even need to happen on a national level. It could also happen within your own hospital or within your own region, more like a balanced scorecard. But you need to be able to prove that I actually made a choice to do a better sustainable solution. So if it costs $4 to remove nitric oxide from laughing gas from giving birth, but if the value is maybe $100 for removing a kilo of carbon dioxide equivalent. So once you can start putting such values, it's really good to install that equipment.
Yeah.
So yeah.
No, I think you're pointing to the fact that, again, at different levels, it's also still appropriate to find those proof points, find the return on investment, and actually leverage that as building out an evidence base to then reinforce the continued investment in this area. Start at the local, scale from there, but ultimately leveraging the examples that are actually proving to be effective to make the argument for further investment down the line. Dr. Ream, I want to bring you into the fold. For those of you who don't know, Dr. Ream wears two hats. Yes, she's the CEO of the National Center for Value in Health here in Saudi, but she's also, in addition to being my boss, the executive director of the Global Innovation Hub for Improving Value in Health. And so at a global level, what role do global policy frameworks like the Paris Agreement and the World Health Organization's guidelines play in shaping the development of climate-resilient health systems?
Well, the global conversations on climate and health are now becoming more and more important. We're actually going to the ministerial meeting for the G20 next week, where climate is being discussed actively. And all these global conversations on climate and health don't actually outline how, or the actual mechanics of how or what to do in order to realize an impact on this problem. And I know, David, we've had this conversation before. And we always say that health and care are very local. So oftentimes, some of the examples, like the one you gave, can be an example that can be learned and modeled, and other systems can follow. The WHO is doing some effort in collating everything that's happening on this. They have a site called Climate Health that has like all the information on the relationship between climate and health. We find it very interesting to think about the perspective in which we come to the association of climate and health, and thinking really about how to impact, or what activities to do to impact the change, which is one of the reasons we published this paper. And future work that we will do will further explore this and take it forward.
Yeah, no, I think it's actually a perfect segue to bring David back in as the principal investigator and author of the report. You went through the recommendations that we put forward in the report, but I think ultimately for the audience who maybe hasn't had the chance to read it yet, what role can adopting the principles of value-based care actually play in building climate resilience in healthcare? You know, what are the key considerations or best practices that could inform strategic decision-making at the health ministerial level?
It's a really good question, and at its largest scale, what we're really trying to do is ensure that we understand the intersection of what climate does to a system that is designed to ensure, or should be designed to ensure, human and patient health. And when we think about that interaction, it can be challenging to understand where that overlap happens. And the question is a good one, because when we think about optimizing our outcomes for the dollars we spent in an equitable way, climate plays a really important role in that. So depending on where you may live, depending on where you may travel, depending on what you may do for a job, all of these can impact the health and well-being that you have as an individual. And all of that can be impacted by climate. And so it's this kind of circular relationship that historically we haven't really thought about. And so at the very basic level, we need to really design a system that, as I noted, is prepared, resilient, and responsive. And to do that, we need data, but we need to actually measure what matters to patients. We need to measure the cost and the dollars that we both save and get by making decisions that positively impact both our ability to address the climate crisis and the health outcomes of our population. And so if we can do all of that, they actually go hand in hand, which is hopefully the goal and the mission. And one of the last things that I'll note is that this idea of a high-value health system is ultimately a strategy and this North Star. It's something that we're all after. Similarly, with climate change, we want to address this crisis. Doesn't mean that tomorrow we change everything right now. We have a goal and a vision in mind, which is what's so inspiring about this conference and what the kingdom is doing. Because every decision that's made, if it reaches towards that high-value health system that addresses that climate change crisis, that's a decision that should be made and should move the discussion and the whole process forward. And so going back to the question, as we address these and we measure and make decisions based off this idea of a strategy, you can really start to see kind of the benefits and reap the benefits of that, both from a health system standpoint as well as a climate standpoint.
Thank you, David. And I think, we talk about at the Global Innovation Hub around the concept of a high-value health system. There's resilience, there's responsiveness, there's efficacy, there's efficiency, but there's also equity. And, Richard, to bring you back in, there's always the risk when we talk about a global megatrend in the health space around how does this affect vulnerable populations. And so, when we think about this conversation that we're having right now on climate change and health systems resilience, how are vulnerable populations, especially, such as low and middle income countries, disproportionately affected by climate change? And how are healthcare systems in these contexts currently responding?
Yeah, okay, so, and that is a really interesting lens to think about this, because some of the biggest the contributors to emissions are obviously the well-developed health systems, yet those that are most likely to be affected are probably those sitting in those vulnerable populations. And when you then think about what's important in the development of the health and care system in those low and middle income countries, it absolutely needs to be about resilience of the health system against climate change impact. That needs to be the priority, when the country is in a state of development and really trying to address basic health inequalities. But there's also an opportunity there, because there's also an opportunity as those countries develop their healthcare system to actually develop a much more sustainable healthcare system in terms of embedding, as I said in my previous point, embedding carbon and climate change in the thinking and the design of the health system, which, 9 times out of 10, when you do something that helps patients or decentralizing services, putting services, digitalizing, putting them into the community, it saves money, it's better for patients, it's also reducing the carbon footprint of the health system. So yes, we need to think about the vulnerability of these populations in the short term and how they deal with the resilience of the health system to deal with climate change-induced events. But let's also think about the opportunity that presents to develop more sustainable health systems.
And I think the opportunities sometimes can feel more conceptual than tangible. I mean, you can read about them in a report or you can come across them in an article. And so I think you kind of maybe coming back, Bjorn, to this conversation around driving real action, sometimes that can be tough if you don't have a concrete template or example to build off of and actually try to replicate or adjust or apply within your particular context. And so I'm curious, from where you sit at Scana Care, what innovative technologies or solutions have you come across that are currently being developed to actually address the health impacts of climate change, and how can they be more effectively integrated into healthcare systems?
I would say it doesn't need to be that advanced technologies. A lot is sharing best practice. And I really like, that's why I have on my LinkedIn profile sharing healthcare ideas, because we don't need to reinvent the wheel all the time. And like Richard was talking about, the developed countries, they have a lot of knowledge, and they also a lot of the reason for some of the impacts which the undeveloped countries are facing. So by sharing the knowledge on how to do sustainable things, a lot of things don't even cost money. It's like doing exemptions lists on chemicals we don't want to use. It's smarter ways of doing. For example, we don't even want people to go to the hospitals. Better prevention, better primary care, etc. So by changing the way we do healthcare, we can actually reduce the impact. And it's only, as far as I know, Sweden and the UK that actually, from a governmental level, are doing this as a consultant, but not at the cost of traditional consultancies. So we actually go around and we share the experiences we have.
I mean, it's easier said than done sometimes. I agree with your point wholeheartedly. I think about where we sit within the Global Innovation Hub and the role that we were established to play of serving as this connective tissue across the G20 plus nations. And so, Dr. Reem, as she mentioned earlier, we're headed to Brazil next week. Climate is one of the priorities that the presidency has put forward in this year, and we hope that South Africa will pick it up next year. But, Dr. Reem's been involved in the G20 since 2020 when she was the Health Working Group chair. I wonder, how can governments and global organizations work together to ensure climate change policies are prioritized within the same kind of health discussion? And then, given your experience in the G20 and that ecosystem, what oftentimes is the barrier or barriers to that type of collaboration and knowledge sharing?
I want to go back to something David said a minute ago in tackling that question. This interconnectedness. We speak a lot about social determinants of health or determinants of health outside of health systems that contribute the most to health outcomes. In global policy, it's a big challenge to have this conversation, because where are the boundaries? And so when health ministers, for example, talk, their domain is the health system. And when you address something that's outside of that, it becomes more complex in addressing in a global policy perspective, even on national levels. Who is responsible for addressing climate or climate and health? Which ministry or which discipline? So that makes it more challenging. And breaking it up into parts makes it more feasible and makes it more accessible for policy conversations at national and global levels. And we think that that's probably the place to start. So that's my view on that.
No, I think you're touching on the fact that this is truly a cross-sector issue. And so David, with the ticking clock here, last question, how can cross-sector partnerships between healthcare, technology, energy, finance, other industries enhance the healthcare system's ability to respond to climate change?
Yeah, it's a good question, because ultimately I am a big believer of aligning incentives. And when we think about aligning incentives, we all have kind of the same goal in mind, and it goes back to Dr. Reem's really important point, is if we spread ourselves too thin across every ministry, across every industry, and we start saying, here's $50 here or $200 here, we need to kind of come together and coalesce and figure out a way where it's the mission collectively to do something, or we're going to start putting these Band-Aids. And so at the end of the day, I really think it's really, really critical to remember that it's the strategy and the singular strategy with this incentive structure aligned, and it's not a technology or AI or any of these instruments or tools don't solve the problem without the strategy and the ideas behind it. You can implement all these technologies and tools, but you need kind of this guiding force, if you will. And I think ultimately that collaboration to have an agreed upon mission and strategy is really what's key to success.
Well, thank you all so much. I mean, whether it is kind of working through and pushing forward this idea of having a comprehensive strategy that is imbued with and informed by lessons learned and not reinventing the wheel, but very much a practical, action-oriented approach that accounts for everything from carbon emissions to the role of finance, to the role of energy, to the role of other sectors. I think, and I hope that the audience today was able to hear the relevance and importance of taking that cross-sector approach in a cohesive approach to taking on the unique challenge of climate change and health system sustainability. So if I may, I'd love to thank our esteemed group of panelists today. I don't see the slide up now, but if they can bring it back up, welcome all of you to please download the Hub's new report. And thank you all for making the time today, and take care.
Thank you very much.